As you age, it's normal to notice changes in your vision. According to the National Eye Institute, some changes are normal, some may become a cause of concern. Actual vision loss is not a normal part of aging, but the risk everyone faces is that as you age, you are at higher risk of developing age-related eye conditions and diseases. Age-related macular degeneration, cataract, which is a clouding of the lens of the eye, diabetic retinopathy, the most common cause of vision loss among people with diabetes, glaucoma, a group of eye diseases that gradually steals your sight without warning and often without symptoms, are some of the age-related eye conditions and diseases. Often, these diseases arise slowly and quietly with no warning signs or symptoms in their early stages. The only way to discover them before they cause vision loss or blindness is through that regular dilated eye exam by an optometrist or ophthalmologist. Today on your regular Health Talk TV show, The Physicians, we'll be discussing vision changes with age. Stay tuned. It's another day with The Physicians, where your health is our business. My name is Dr. Martina Agbere, your regular anchor on this program, and today we'll be discussing vision changes with age. I'm not alone on this program. I have with me my co-anchor, of course, always very beautiful, looking really elegant. Is no other person than our very delectable
Dr. Memuna Yusuf Kadri. Welcome to your favorite health TV talk show, The Physicians, where your health is our business.
And will always remain our business.
Our business.
Talking about vision changes with age, don't say what I think you want to say. Please. Don't go there. So I want to preempt you before you go there. Okay? Don't go there. Vision changes with age.
What?
Yes, I'm not make your statement without reference.
I'm not going there.
Okay. Vision changes with age. Okay. When you hear about that, what comes to mind? Remember, be guided.
You.
Me. Now you have
because
started.
Because you're elderly.
Yes. Because I'm aging gracefully too.
And it's a privilege.
Yeah, but the way you do it doesn't look like it's a privilege.
It is a privilege. Because I tell my people that my co-host is an elegant, beautiful physician who is aging gracefully. She uses, spectacles, but they're always looking very beautiful.
Thank you very much. But so, I know very well. I always know your intentions. I know what you mean, okay? So now we're talking about vision changes with age. Yeah. What it simply means in the context of what we'll be discussing today, it has to do with the fact that as you age, there are certain health conditions that have to do with the eye that come with it. Because oftentimes when you talk about the way you just go looking at somebody with glasses and say the person, children also use glasses.
Of course. I have 2 kids that use
glasses. Anyway, today we'll be talking about vision changing with age and a lot of disease conditions that come with this, like cataract, glaucoma, macular degeneration. Now you know these names. So next time, remember that this is what you should do. Don't say any more words. We'll be back after the short break. Stay tuned.
Every day and in every way, enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Diabetic nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Diabetic from LB Pharma. Diabetic, love yourself.
Welcome to your regular Health Talk TV show, The Physicians, where your health is our business. We're discussing vision changes with age. With me today, as our guest, is no other person than our very beautiful Dr. Yemisi Soyombo. She is the MD CEO, ICARE Children's Family Vision Center. You see how you manage the children?
Yeah,
adults too.
It's a family practice, from adults to children to grandparents.
Okay, so that is where the family is. So ICARE Family Vision Center. Let's join and welcome her. Welcome to our program.
You're
Thank
welcome,
you.
pretty.
Thank
Always
you.
looking pretty.
Thank you. I'm also very happy to be
Before we
here.
continue, I want to ask you a question, right?
Please do.
I have my glasses on.
Yeah.
She doesn't have, right?
Yeah.
Oh, you don't have?
Yeah.
Do you use glasses?
Yeah, I do use glasses.
The contact or no?
Prescription lenses.
Prescription lenses.
I'm actually
okay.
long-sighted, so
Okay.
sometimes I experience a lot of frontal headaches. But I lose my glasses a lot because of work. Most times when I have to check patients, in fact, I have them in my bag. When I have to look into patients' eyes to use the ophthalmoscope, I have to take it out, and my job is very engaging. Either you doing some procedure, checking inside of the eyes, you're always in their faces, helping them choose eyewear, putting it on your face as the model.
Yeah.
So I see that on that journey, I lose my eyewear a lot.
But it's easy for you to just pick. You just go to your shelf and just pick one.
It's not easy on our business. It's business. So
Okay, so I'm just imagining doing that. Okay, now let's go to the business of the day. We're talking about vision changes with age.
yeah.
So I believe you want to tell us some of the health conditions or the disease conditions that we expect. Like in the introduction, we said it doesn't necessarily mean that everyone who ages must have this condition,
No,
right?
necessarily.
Okay,
Yeah.
so let's talk about it. So as we age, what are the most common vision changes that we can expect, and how do they impact on daily lives?
Okay, thanks for the question. There are a compound of diagnoses we call age-related visual changes.
Okay.
And the number one predisposing factor to these diagnoses is aging. And it's so important to talk about this because all of us would age gracefully. I mean, it's the beauty of life. Now, certain diagnoses or certain diagnoses come up more as we age. Number one is cataract. Cataract is known as the clouding of the lens. I'll try to use layman's terms because I understand that we have a vast audience.
Yeah.
Sure.
So going back to cataract, it's the clouding of the lens. That's the one people talk about when you hear them say, I have a white thing in my
eye.
you know. We'll talk about it in depth more, but let me just go over them. And then we have diabetic retinopathy, which is very common in this area or in our client because we have too many Black people, too many Nigerians. I remember there's a research that I had to read on it to say that Nigerians had a very high predisposing, high diagnosis of diabetes, which leads to diabetic retinopathy. Another thing that I would like to talk about is glaucoma. Glaucoma caused by increased ocular pressure affects the nerves in the eye. And then lastly, age-related macular degeneration. You see what it's called? Age-related macular degeneration. So it affects the retina, a lot of times the macula in the macular area in the retina, and it also leads to reduced vision that sometimes cannot be resuscitated. So these are the common age-related eye diseases that we see in the clinic.
Okay, age-related, right?
Yes.
But
yes,
I
yes.
know we also have children that are born with cataract.
Yes,
right?
we have children that are
So
born
how
with
do you want
cataract.
us?
How do we distinguish
Yes,
that?
please.
So some children are born with what we call congenital cataracts.
Okay.
And just like other congenital diseases that happen, those are things that happen during the fetus development, whether it's in the eye, in the body, or in the brain. So it is that cataract is naturally from events that have happened with the fetus development or the child in development while in the belly. Now, moving on to the age-related cataract. Age-related cataract happens as we age, and that's because the lens in the eye, God is wonderful, is elastic. It's actually made of protein materials and is naturally transparent. Over time, just like we have the nylon, those proteins begin to break down. And when they break down, that's the white thing we see that causes the opacity. Opacity means covering up, the lens. And remember that the light has to pass through the lens to hit the retina. So when the lens molecules or the protein molecules that make up the lens are broken down, it covers up that passageway, and that's what leads to reduced vision long term. Or sometimes some patients cannot even perceive hand movement or light until there's an excision of the cataract.
Wow. It's becoming more interesting because, yes, we all desire to age gracefully, and it's a privilege to get old. It's not everybody that will be old. That's just the truth. So if you find yourself,
it's a blessing.
It's a blessing, of course. But these are things that are not within our control. Things that come with age. But it's how much you then ensure that you have good quality of life that can help minimize, the complications and all that. So, can you elaborate more on this? Talked about cataract, glaucoma, presbyopia. Yes. Lives? So how, because now these are age-related. So what is their impact on the quality of life? The burden of care among the caregivers, and what people should actually start doing differently.
Yeah, especially knowing that some of these things cannot be controlled.
Exactly.
That's why they're called age-related. Yeah, it's a good question, Dr. May, because information is powerful, and practicing the information you get from platforms like this helps give you better quality of life. Now, going back to the question directly, it does impact the rest of your life. If you're held down with, for instance, age-related macular degeneration that affects the macula in the retina. And what happens with that is it steals the central vision and leaves the peripheral vision. So people who experience this will only majorly see with the side. And like I said, for that, the prognosis for returning the vision back to 100% is really slim. Or for cataract. Cataract, just like you called it the other day, gospel. There's gospel for cataract, meaning that when there's early detection, it can be excised. A fake false lens can be put in, artificial lenses, and the patient can get to see better, mostly for the rest of their life. Talking about glaucoma, glaucoma is also very dangerous. And it's called the thief of sight, because for most patients, they don't get to know until it's late. And the predisposing factor for glaucoma is genetics, meaning is there a family history of blindness, or somebody has gotten blind, then there's a tendency that it passes through the genes. Another predisposing factor for glaucoma is being black.
Ouch.
Yeah.
So we being black now, we are more at risk.
Yeah, we're more at risk.
Any genetic
mutations for now, prevention is just the key. Sensitization is just the key.
About one status, male or female?
Right now, it doesn't select any gender. Both male and female are So why have I talked about all of these things, and how can we help ourselves? First of all, healthy lifestyle. I tell people a lot of times that it doesn't start and end with the clinic. It actually starts with you. I was in a conversation with a few friends of mine, and I was saying to them that one of the things that I decided to do this year is love me enough to take care of my health.
Yep, self-love.
Because sometimes we're so focused on the outside, the makeup, the fine dress, and the inside of your body is getting bad. And even right now, whether talking to myself, I know this is a big audience, myself or people older, I would say that annual health check is not as expensive as the Ashwebi. It's also very important, because that way you find out things that can be arrested on time. And coming back to vision, a lot of all this diagnosis can be arrested if we find out on time, if we practice good lifestyle. You are what you eat. So from eating healthy, exercising healthy, protecting your eyes with the right kind of eyewear or prescription lenses, it goes a long way to make sure a lot of these things won't manifest. Let's talk about cataract. Earlier, I talked about the fact that the breakdown of the lens structure, the protein that makes up the lens structure, is what leads to cataract most of the time. There are other forms of cataract, but we're focusing today on age-related eye diseases. How can this be prevented? First off, making sure that your eyes are protected from a loss of rays, the sunlight, UV rays, yes. Another way of preventing cataract is linked to diabetes.
Yeah.
If you are predisposed to diabetes or have been diagnosed with diabetes, it is very important to make sure that every advice, both medical and lifestyle advice from your GP or your endocrinologist, is practiced to the letter. What to eat, what not to eat, exercise, and so forth, and so on and so forth. So it's very important, because when diabetes is not managed properly, not only does it lead to diabetes retinopathy, which are changes in the retina, it also leads to an early onset of cataract, and which is related to the age-related diseases. So, but there's good news, meaning that cataract can be excised, can be taken away surgically. In fact, there are new inventions. There's laser surgeries for cataract, there's phaco, there's so many options, but it can be taken out if it is found out on time and if there are no other complications going on in the eye. A consultant surgeon will make that decision on whether you're a good fit to have a surgery or not. However, most often than not, it is done, and the prognosis after is always positive, and people can return to their normal day life. In fact, on my NGO platform, we recently had someone who we were able to help out with a cataract surgery. He's a 60-year-old truck driver whose means of livelihood was cut short because of cataract, and we're able to raise funds, and now he's back to work. So there's solution and there's help with cataract. Now let's move on to the one you talked about. That's the tip of sight, called glaucoma. You know, glaucoma damages the optic nerve in the eye and leads to increased eye pressure. And like I usually say, it is popularly known as the thief of sight. Thief of sight because it doesn't give any warning. People just wake up one morning and realize that they can't see clearly. The predisposing factor, again, going back, is being black and a family history of glaucoma.
You said it damages the optic nerve, right?
Yes.
What does the optic nerve do? What does it do?
The optic nerve both helps with passing messages to the brain, through the retina. The optic nerve is what we also call the power source of the eye.
So if it damages it, you can imagine what.
If it damages now,
it's
there's no replacement.
It's like the power source has turn off.
There's no replacement. You know, and that's why it's very important. And when we find out or diagnose glaucoma, that's the focus, to make sure that the pressure, why are we reducing the pressure? There are various ways to reduce the eye pressure, either medically, maybe with eye drops, or surgically with creating a bleb to reduce the pressure in the eye. Why are we reducing the pressure? Why is that the goal? Because we're trying to protect the optic nerve. You know, so if you have a family history of blindness, even if you're not sure of what caused the blindness, by the time you start getting to your 40s, if you've never had the habit of a regular eye check, this is the time. Don't wait till tomorrow to do it, so that when we find out on time, it's managed properly. The only solution for glaucoma is early detection and management, because for now there's no cure. You know, then it reduces the quality of life.
So something just came to mind now, talking about reducing the pressure so that the optic nerve is not damaged.
Yeah.
I think I just want to liken it to controlling your blood pressure.
Yes.
Because if you don't control your blood pressure, the effects on the heart, and you stroke out.
Yeah.
And you come down with stroke.
Yes.
So that's what happens.
Death.
Death.
So this time is the death in the eye.
So now it's the eye. If you don't reduce the pressure, it hits on the optic nerve and it's blindness.
Like the light is pulled off, and that is it.
Yeah. And then diabetic, I don't want to forget to touch the diabetes, because we're a lot of Nigerians over age 40.
It's a common non-communicable disease.
And that's because of other factors like what we eat,
lifestyle,
you know,
exercises
and a whole lot. Now, what diabetes does is that it damages the blood vessels in the retina. Yeah.
Those tiny blood vessels.
Those tiny blood vessels. And sometimes the body's mechanisms to self-defend makes those blood vessels start to grow neuro vessels, like smaller vessels, thinking that we need help. And because of how weak and fragile those new vessels are,
it does rupture
and starts to bleed. And that's why it's called diabetic retinopathy, because it does so much damage to the retina. You know, how do we prevent this? Goes back to managing the diabetes itself, because that's what's causing
That's underlying pathology.
Yeah, that's the underlying pathology. And that's why I said earlier that stick to whatever the endocrinologist, whatever specialist is managing, food, medications. I know in this climate we're very religious, you know, very, very religious.
Again,
I've had a patient walk into the clinic, in fact, recently, and I knew that he was diabetic because we had been managing him for a while, and then he was stable. And this year, he came into the clinic for an annual check, and I started to see things, some spots in the eyes, and certain things that we're hoping not to see in patients that are diabetic. And when I asked him what was going on, he said to me that, God is in control, and he had stopped using his medications because anytime he checks in the morning, he realizes that the sugar level is low, and so now he knows what to eat and what not to eat. And doc, this patient is close to 67.
I'm sure learned.
Learned, very much learned. And I said to him, okay, did your doctor
say you should?
Did your doctor? That's the part that got me off.
And
it threw me off balance.
Yes, and that is why it's important we quickly nip on board this question so that our viewers will take it away from here. What's the importance of early detection in managing generally age-related vision? And if you can enlighten us on some key warning signs, what are those things individuals should be aware of? To just know that this is what, at this point, I need to say, doctor, at this point, I need to be referred.
Very good question. Floaters. Are you above the age of 40 and you're beginning to see floaters in your vision? Or what some people will say, cobweb. I'm seeing cobwebs in my vision. Seeing floaters in your vision is an indication that you should go for a test. Blurred vision, sudden reduced vision. So I see yesterday, I don't see today. Now, one tricky part is when patients begin to complain of their glasses. In fact, a lot of times when I read your history or I ask you questions, and that's why history and opening the door to good communication with your patients is very important. In fact, you can make good clinical diagnosis by just listening to your patients. You know, when I ask you questions, especially some people in a certain age group, probably and come in and say, oh, I've been to this clinic and that clinic. And it seems like they're not getting my prescription. A lot of times, those patients are diabetic. So if you see that you're changing your glasses too often, in a year, your prescription is changing 3-4 times, that's the right time to start going in. So headaches, blurred vision, floaters, peripheral vision, you see that your central vision is lost, it's very important to find yourself into the clinic.
And that is, and that's why early detection at this point in time helps to reduce the complications.
Early detection is key.
So what are the specific eye exercises or habits that we can all help to maintain good vision? Because we're talking about age-related. So the earlier, I'm not old, I'm still young.
Yeah, I can see.
Yeah, so please, let's educate me.
Young and shiny. So I just want to show them quickly. First of all, like I said, your overall lifestyle influences your health, from exercise to eating properly. You are what you eat. Some recreational habits we have: smoking, drinking, smoking especially. It predisposes you to a lot of diseases, including eye diseases. Annual health check is very important, from the crown of your head to the sole of your feet, like some people would say. It's also very important. And then lastly, taking us back to your last questions, when you notice any of this discomfort or any of these symptoms, it's not time to pray it away. It's not time to wish it away. It's time to get yourself away into the consulting room.
It's your time to get
into the consulting room.
I think that's a very good way to end this conversation, but not without you telling us the reasons, or if commercial drivers are excluded from these diseases that you just mentioned.
You mentioned it earlier, and I thought you were joking.
Yes.
Commercial drivers are not excluded.
Have you seen commercial drivers, bus drivers actually use glasses?
Wearing glasses.
No, and funny enough, I was talking to Dr. May about a recent public sensitization we did at the Lucky Phase 1 gates, where we went to the bus drivers to educate them, we give them glasses, but most of them will use it maybe when they're trying to read on their phones, but they will not wear it. And I perceive, I haven't looked into data, but a lot of the accidents, especially on our Lagos roads, you know, come from the fact that the drivers are not seeing properly.
They're not.
You know, so I think that's
I think it's a law.
A good platform like this should work with the government and other stakeholders to make sure that.
Thank you very much, Dr. Soyombo.
Thank you for having me.
Pleasure having
I'm
you
always
here.
happy to be here.
The rest assured I will invite you again.
I know.
I really appreciate you. I'm sure our viewers out there actually have benefited so much from what you have said. You talked to us about cataract and everything. I say, really appreciate you. Thank you. And to our viewers, I just want to say thank you for being part of our program today. You remember, the physicians never watch it alone. Always call somebody to tell somebody about the program. So you can, every time you are watching, someone is always there with you to benefit, because you cannot always explain what you have heard to another person. It's always good to hear it from first hand. Remember to do your annual checks. If you haven't done that, please try as much as possible to go for your eye check. Glaucoma, you heard, is a thief of the sight. Most times you'll be able to see just from the side, but you will have real vision. So lifestyle is also very important. Try as much as possible to eat healthy, weight loss, exercise regularly. I won't, without saying, remember to exercise, because if you put exercises, the benefits as a pill, will be the best soul pill in the world. On this note, I say thank you for being part of our program. My name still is Dr. Martina Agbere. Stay blessed.
Thank you, Dr. Yemisi, and I'm happy that you've already assured us you're coming next time we call you on board. Thank you very much. Our viewers also enjoy having you here anytime you speak to us. You nail it, you make it very relatable, and because we know that there's a power to sight. Once you are not seeing, it's always as if you've lost it completely, and you always bring light when you talk about things like that.
Thank you.
So to our audience, thank you for always keeping a date with the physicians, and I will encourage you to please follow us on all our various social media platforms so you don't miss any information that will help you, not only you, but also your loved ones. If you want to binge on any health program that will help you, aid you, support you, encourage you, and spread the right information, go to our YouTube page and you have all the right information. And you want to be part of us, like just as we have Dr. Yemisi here, you are just a click away. Go to our website, fill the form, and you'll be here. You don't have to be a doctor. You have a story to tell, come and share that story. You have somebody who has been through a health challenge and you believe that that person needs to be here, also bring that on board. Until next time, my name remains Dr. Memuna Yusuf Kadri.
Every day and in every way, enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
THERAPEUTIC nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. THERAPEUTIC from LB Pharma. THERAPEUTIC. Love yourself.